What disability insurance carriers don't understand about the excessive heart rate increase in POTS cases. Now, I find the disability carriers don't understand many of the things about postural orthostatic tachycardia syndrome. Notice POTS. One of the primary things they don't get is why the heart rate increases excessively with POTS while the structure of your heart is normal. They can't figure that out. They can't figure out why you have cardiac issues if your heart is normal. And this lack of understanding can result in delay, denial, or even termination of a legitimate claim. Now, POTS affects 3 million Americans, and it's a disorder of the autonomic nervous system. That system regulates our heart rate, our blood pressure, sweating, and our body temperature. Now, I want to take apart the terms postural orthostatic tachycardia syndrome because I think the carriers don't understand what each of those words mean. So let's talk about the first. Postural refers to the position of your body and the fact that you have symptoms as you become upright. Orthostatic refers to the act of standing up. Tachycardia refers to an increase in your heart rate, and the syndrome is a group of symptoms. So when I'm trying to present a POTS case to the carrier, I really am hammering on all 4 of those words because I want the carrier to understand what that means in terms of your symptoms and your functionality. So let's talk about the tachycardia or the increased heart rate. For the most part, the structure of the heart with those who have POTS is normal. And again, the carrier doesn't get why you would have symptoms if your heart is normal. And the POTS symptoms are caused by a number of factors. One is the lower amount of blood in circulation, an excessive pooling of blood below the level of the heart when you're upright, and elevated levels of hormones released by the adrenal glands or norepinephrine, which is released by nerves. So the carriers don't understand that. And then they don't understand when we stand, gravity pulls more blood into the lower half of your body. Our body activates certain nervous system responses to make sure there's enough blood reaching your brain. So, for example, your body will release hormones that will tighten blood vessels and cause a modest increase in your heart rate that allows for the blood flow to the heart and the brain as you stand. Now, once your brain gets enough blood and oxygen, the nervous response returns to normal. But in cases of POTS, the blood vessels don't respond properly to the signal to tighten. The longer you are upright, the more your blood pools in the lower part of your body. And as a result, you're not getting enough blood to your brain and you feel lightheaded, fatigued, and you may even have brain fog. Now, the nervous system will continue to release chemicals in your body that will tighten the blood vessels, and the heart rate will continue to increase, and that causes shakiness, skipped or forceful heartbeats, and can even cause chest pain. So the disability carrier doesn't understand or appreciate the impact of pooling and the symptoms that occur that can make you disabled. Now, there are some people with POTS who have a drop in blood pressure while standing more than 3 minutes upright. On the other hand, others can develop an increase in the blood pressure, which is known as hypertension, when they stand upright. And obviously, these symptoms can vary from person to person. As a result, when the disability carrier looks at the POTS cases, they try to use a cookie cutter approach and apply a one size fits all. And POTS just doesn't work that way. One of the tips that I give my clients is to use activity of daily living forms, or more appropriately, a log that shows what your symptoms are on a daily basis, the range of your symptoms, what happens to you because of those symptoms, and how this impacts your ability to function. And so I think that is a way to document to your doctor the nature of your symptoms, the frequency of your symptoms, and how those symptoms impact your ability to function. That will help your doctor answer all the disability carriers' questions about your diagnosis and your restrictions and limitations. And obviously, it should be shared as appropriate with the disability insurance carrier, because I don't want the carrier to put their head in the sand and ignore postural orthopedic tachycardia syndrome and the impact of your increased heart rate in your disability claim. I don't want them to delay, deny, or even terminate your claim because of a lack of understanding of what POTS is. So I'm going to talk next about what carriers don't understand about neuropathic POTS, hyperhidrotic POTS. I'm sorry, I have trouble saying that. Hypovolemic POTS and secondary POTS. So stay tuned.